name is Jesse Jupiter. I practiced orthopedic hand surgery and trauma surgery at Massachusetts General Hospital for 45 years. I'm currently clinically retired, but I still teach every week back to Boston and do a good deal of clinical research. Well, like everything else in our overall specialties, whether it be hand surgery or plastic or orthopedic, technology has come about. So if one looks at the exhibit hall, the quality of an advancement of technology has influenced even the programs at the Hand Society. There are many, many educational opportunities for hands-on learning in conjunction with industry. So some people might feel that that might be somewhat of an oxymoron, but it's very educational, and I think without the industry, you couldn't do that. Well, I think the incorporation of technology has, of course, made a difference in every aspect of hand surgery, whether it's arthritis or tendons or nerve or soft tissue. So that technology, we've seen microsurgery and transfer of parts, and I put together a program when I retired about my experience in microsurgery, and when I show it to people, they're just overwhelmed because it's amazing what we were able to do and we continue to be able to do with that. So I think that the technology in that realm continues to evolve as we understand the anatomy better. Every aspect of soft tissue, tendons, nerves, and things, we're continuously evolving. And I think take something like arthroscopy, which is challenging the need for actually doing open surgery in many areas. And so that's pretty exciting stuff, all benefiting the patient. What it really is needed and to be discovered is ways to recreate natural tissues. So we do surgery, we call it reconstruction of ligaments or tendons or tissue elsewhere or nerves with sometimes tissue that's not alive or that doesn't have the properties of the original tissue. So we say the reconstructions work well, but they don't work well enough because the biologic aspects is a big area that needs to be developed. And recreating nerve tissue, recreating ligaments and things like that, which will come from the lab, not from the saw and chisel, but it will happen, and that will make a big difference. Where my interest developed from into hand surgery was from one mentor, Richard Smith. But along the way, it was so exciting as a young hand surgeon to meet these names. It was a small organization, it was collegial, and to be able to meet and talk to Dr. X and Y and Z was what made you part of the game, part of the team, so to speak. And unfortunately, that changes as organizations get bigger and bigger and bigger. But to be able to mentor people within your institution, within your fellowship program, we take it for granted sometimes, but it's a very special opportunity to influence young people. My feeling has always been, if you have an opportunity to follow your passion, do it. If you have an interest in academics, do it. Don't ignore the economics. if you could. If you're interested in subspecialties of microsurgery, whatever, do it. And don't hesitate, because there's always a limiting factor of getting into something. But if you have that opportunity to take it and decide if you can early on, that's what I would recommend. Follow your passion. Don't get caught up in, lifestyle to the extent that it influences your perspectives of hand surgery.